Hatvet PHARMA welcomes you to the ocean of practical knowledge about small animal practice, that is, Hatvet's YouTube channel. We are thankful to our honorable speaker and session moderators for sharing their valuable time and knowledge with us.
Today presenter Dr. Arun Kumar, my friend, and he finished his MVSc from Indian Veterinary Research Institute, IVRI. You all know that is national level institute, the topper only they get into the admission there. He underwent the MVSc IVRI, then he joined as assistant professor Tamil Nadu Veterinary Animal Science University. He is having a nearly 25 to 26 years of academic experience. He has published a lot of national and international papers, and he has written a lot of books. And this actually recently he guided on a topper ARS, mainly on Hemoprotozoan disease, especially on Babesiosis and their management. One of the PhD student he guided, and I was the member. In that context only, our country having alarming problem of Hemoprotozoan disease. We are number one in the canine populations, and similarly, we have a number one population of Hemoprotozoan disease. It is a lot of challenging, and many times we are trying with a lot of latest protocol. Many times we fail. Because why we fail, there are so many factors behind it. There are so many protocols that are available, and counseling the owner and telling the in and out about the Hemoprotozoan disease is very important. Once they understand, the owner understand your treatment approach, then it will be easy. And there are a lot of mortality we are facing. Now I request Dr. Arun Kumar, get into the topic and current insight into canine hemoprotozoan disease, pathogenesis, and the control strategy. Dr. Arun, you continue in the discussion part. I'll join. Anyway, I will observe you all your presentation.
Okay, sir.
You can text me WhatsApp. I come and join for the interaction.
Okay, sir. Okay, sir. So
Please,
thank you, Professor Chandrasekhar, for a nice introduction. So my topic is on current insights into the canine hemoprotozoan diseases, mainly pathogenesis aspect I will deal. Actually, the title it is really a critical and emergency situation, the hemoprotozoan diseases nowadays, because everywhere if you see, if the animal is affected with simple loss of appetite or fever, suppose if it come to the clinic, then we will rule out all the diseases, even for bacterial, viral, or even some of the systemic diseases. But sometimes we will fail to rule out the hemoprotozoan diseases. So what will happen later on? It will slowly progress into a chronic form. Then finally it will end up with a severe organ failure. Then finally the death will occur. So, but nowadays we are mainly focusing on hemoprotozoan diseases, particularly canine. Even in our Madras Veterinary College also, we are mainly working along with Dr. Chandrasekhar. We are working on canine hemoprotozoan diseases, pathogenesis aspect and control. And also we are currently working on feline hemoprotozoan parasites. One of our students is studying feline hemoprotozoan parasites. So nowadays it is very important disease, and also it is a very difficult to treat also. It is giving a very tough challenge for veterinarian or practitioner. So in this context, I will touch upon all the important aspect of canine hemoprotozoan diseases. Next slide, please. So normally these canine hemoprotozoan, next slide. They are all mainly a vector-borne disease. So vector-borne diseases are mainly common in India. Even in large animal also, vector-borne diseases are there. In small animal, particularly in case of canine, Babesiosis is one important disease. Then Ehrlichiosis, then Hepatozoonosis some extent, then even Anaplasmosis, even some of the Trypanosomosis also sometimes it affects canine. Then Mycoplasmosis. So, but I am mainly concentrating on canine Babesiosis, then followed by Ehrlichiosis, then Anaplasmosis little bit, then Hepatozoonosis. Next slide, please. Next slide. Okay. So suppose if the animal a dog having a tick fever, in that case, immediately what the clinician will do is, first he will take a blood smear nowadays. But in case of canine babesiosis, examination of blood smear and detecting the parasite is somewhat difficult, with a particular reference to Babesia gibsoni. There is a very small form of Babesia. In Babesia, there are two forms are there. One is large form, another one is small form. So the large form is based on the size of the organism. That means if it measures more than 5 micron, that is large form. If it measures less than 2.5 micron, it is a small form. But the Babesia gibsoni is a small form. So it is very difficult to diagnose in the blood smear. So that we will miss, because they are pleomorphic. Sometimes it will exhibit amoebic form, or even small dot or ovoid, like that. Whereas another Babesia, that is called Babesia vogeli. In India, Babesia vogeli is the common one, not Babesia canis. So the Babesia vogeli is the larger form, measuring more than 5 micron, and also it appears as a pear-shaped form, forming an acute angle. So that for diagnosing Babesia gibsoni infection, blood smear alone, it is not sufficient. So that nowadays we are going on to the molecular method, particularly based specific PCR-based approach. Next slide, please. So the main vector is Rhipicephalus sanguinus in our country. Apart from that, no other vector predominantly encountered for canine babesiosis, as well as Ehrlichiosis or even Hepatozoonosis. Next slide, please. If you see the vector, the Rhipicephalus sanguinus three-host tick, the dog tick or kennel tick is the vector, because the adult tick will feed on the dog, then again it will fall onto the ground, then the egg will develop, then from that the larvae will come. The larvae will feed on the another host, that is host 1. Then again the larvae will feed on the blood from the animal, then the fed larvae fall onto the ground, then mold to become nymph. The nymph again will feed on the third animal, then it will get full blood meal, then it will fall onto the ground, then the nymph again it will infect the adult. So why I am telling, because in the control aspect is very important. So it is a three-host tick. So in the controlling the parasite, we should not always focus on the animal alone, animal body alone, using various latest available drugs, or even powders, or whatever may be the ectoparasiticide. Because it is a three-host tick, so each stage of the tick will infect the animal in the surroundings. So so that we have to concentrate mainly on the life cycle of the parasite. It is very important. Next slide, please. So the types of Hemoprotozoan diseases, mainly the causes tick fever, Babesiosis. Then another two are Anaplasmosis, Ehrlichiosis are classified under rickettsial disease. Though we are studying sometimes in protozoology, but it is a rickettsial disease. The Babesiosis, there are the species, Babesia gibsoni, small form, already told you. Then Babesia canis vogeli, that is the common large form of the parasite present in our Indian subcontinent. Then Babesia canis rasi, it is not prevalent here. Then Babesia canis. Similarly, for Anaplasmosis, Anaplasma platis is the organism. It is mainly infect the platelets. So that is the peculiarity of the organism. Then third one is Ehrlichiosis. The Ehrlichia canis is the one prevalent in India. It infects monocytes. Then another one called Ehrlichia ewingi, that is mainly infect neutrophil. It causes human granulocytic Ehrlichiosis. So this Ehrlichia ewingi, it was first discovered in the year 1971 at Oklahoma State University. Dr. Professor Ewingi, because of his name only it was given. Then later on he worked on Ehrlichia canis also. So in the year 2023 March, myself and Professor Dr. Sandesegar went to Oklahoma State University and we visited his laboratory. So he lot of diagram on how to identify the Ehrlichia. So he himself in a handwritten manual, or even some of the olden days photograph. Those days there is no advanced equipments are not available. So we saw many photographs in that. Even nowadays also they are working on Ehrlichia canis in Oklahoma State. Next slide, please. This is the organism, how it appears in the blood smear. So in the blood smear, it forms a acute angle. This is actually it is a large form of Babesia. That is Babesia vogeli. Next slide. In the small form, normally it appears in a amoebic form or even small rod form. You cannot expect a clear-cut pear-shaped form in case of Babesia gibsoni. So the canine babesiosis is very common in tropics and subtropics. Mainly the transmission route is through the tick bite. Then apart from that, transplacental transmission recently reported. Then another recent article says that the Babesia canine babesiosis transmission is mainly through the biting between the dog. Suppose if the infected dog bites another uninfected dog, then it will get the infection through the bite. It is transmitted. This is a recent report article says regarding the Babesia gibsoni. Next slide, please. So these are all the Babesia species available geographically, but as far as our India is concerned, we are only concentrating on Babesia vogeli and Babesia gibsoni. That is mainly Bacteris Rhipicephalus sanguinis. But in other foreign countries, and there are different vectors are there, Amphioma vector or Dermacentor vector, so that we are not bothered about that. Next slide, please. So these are the distribution of vectors of canine babesiosis. Mostly in South America, you can see mainly the Amphioma and the Dermacentor ticks. Only in India, we can see the Rhipicephalus sanguinis mainly predominantly prevalent in our Indian subcontinent. Next slide. If you see the incidence of babesiosis, this work was carried out for the past 10 years. So the incidence is nowadays, it is greater when compared to 2009. So even when compared to between the Babesia canis and that is Babesia vogeli and gibsoni, the gibsoni incidence is high. The graph clearly shows that the blue color represent the incidence of Babesia gibsoni. So it is always higher rate of incidence. This was recorded by a ELISA test. Next slide, please. So this is the actual life cycle, but I don't want to go inside into the life cycle. Simplified manner, I will tell. Suppose the infected brown dog tick having the organism, that is a sporozoid stage, that is the infective stage of the parasite. When the tick bites, the tick will inject the sporozoid. Then the sporozoid enter into the bloodstream. Then it will undergo asexual generation. Then after that, the uninfected tick, if it feeds on the infected dog, then it will take the pyroplasm stage. Then it will enter into the tick gut, where the sexual generation occurs. Sexual generation, that is gametogeny cycle. Then after that, formation of zygote, then porogony. Then the sporozoids are come into the tick mouth parts. When the tick bites the uninfected dog, it is transmitted. So actually the Babesia life cycle is very complex, but I told in a very simplified way. So this is the life cycle in detail. But here one point I have to emphasize is the transmission is by trans-ovarian transmission through the tick, as well as the Rhipicephalus sanguinis is a 3-host tick. So it will mainly transmit transstadial. That means even each stage of the ticks, that means larval stage or even nymphal stage. So each stage will spread the infection. So that is the meaning of transstadial transmission. But trans-ovarian means the infected adult keep on transmitting the infection to the progenies. Next slide, please. So now coming on to the how the pathogenesis mainly occurs after the tick bite, now it parasitize the red blood cells, RBCs mainly. Then the major destruction of RBCs occurs. More than 75% of the RBC destroyed. So that it leads to progressive anemia. Then final stage, hypoxia. Then because of hemolysis, there is a platelet aggregation, thrombocytopenia will occur. So then, and also the anaerobic metabolism, then microvascular stasis. That will occur. Then further the hemolysis will lead to hemoglobinemia, then bilirubinemia and jaundice. Then endogenous pyrogens will develop. Then finally the fever will occur. Then another important aspect in the pathogenesis, normally in canine babesiosis, the pro-inflammatory cytokines are released. So that is a major important pathogenic effect of the canine babesia. So the pro-inflammatory cytokines are nothing but they are cytokines. They are released by the immune cells in response to infection. So the pro-inflammatory cytokines are mainly the TNF alpha, interferon gamma, then IL-6, interleukin 6, interleukin 8, then interleukin 18, then MCP1. MCP1 means monocyte chemoattractant factor, MCP1. So these are all signaling molecules. All these pro-inflammatory cytokines are signaling molecules. So this signaling molecule will produced by the immune cells in response to the infection. So in canine babesiosis, the pro-inflammatory cytokines are increased level. So suppose for the recent days, what literature says, if you want to control, treat canine babesiosis, we have to target the substances which will suppress the pro-inflammatory cytokines. So thereby the severity of the disease will be minimized. What is the outcome of the disease? If the pro-inflammatory cytokines are higher, then it will cause a increased vascular permeability, then basic endothelial cell damage. So like that, it will lead to severe complication. Finally, it will end up with near systemic failure. That is the multi-organ dysfunction syndrome. So it will end up. So that the recent concept is we have to target drug to suppress the production of pro-inflammatory cytokines. This is the major pathogenic effect, recent aspect of the canine babesiosis. Next slide, please. So this is the thing I told you: disseminated intravascular coagulation, then systemic inflammatory response syndrome, SARS, then multi-organ dysfunction syndrome. And this is why happening, because we have to thoroughly you have to examine the animal, diagnose the animal. If you are not diagnosing the animal in right time, so this will move on to the chronic situation, then finally end up with the death. Next slide, please. So these are all the signs I don't want to tell, because clinicians will know very well about all the signs of babesia. Even in clinics, the dog with a dull and inappetence, then mild fever, only that type of symptom will be showing. But we have to rule out all the possible causes of the disease, starting from bacteria, virus, or even Hemoprotozoan. Nowadays, we are mainly doing PCR test for the diagnosis of canine babesiosis to identify the early infection. Next, please. Next slide. So these are some of the dog affected with the canine babesiosis. You see jaundice, mucous membrane, yellowish mucous membrane. The yellowish gum color of the jaundice or icteric dog. This is the normal gum on the left side, then right side, that is a yellowish jaundice gum. So it shows the severity of the disease. Next slide. So suppose how to diagnose the disease, clinical signs we cannot rely upon. Whereas in case of bovine babesiosis, in case of bovine cattle, based on clinical sign, we will diagnose more than 70% of the case, because where we will get a coffee-colored urine because of the excessive hemolysis of the RBC, coffee-colored urine will be there. Whereas here you cannot get clear-cut hemoglobinuria, so that we have to always rely upon blood smear microscopy. That is the first step. In that we can detect the large form of the Babesia or small form. But it is very difficult to detect the Babesia gibsoni, as I already told you. So that we have to straight away move for the PCR based diagnosis. In the PCR, we will get the confirmed case of Babesia gibsoni or Babesia vogeli, whatever may be the thing. Next. So in the peripheral blood smear, suppose if you see how to differentiate between the Babesia vogeli and Babesia gibsoni. In Babesia vogeli, it is a pear-shaped form, clear cut, then acute angle will be there. Whereas in gibsoni, it is not a clear cut pear-shaped form, or if at all there, it is a divergent angle. That is one of the important difference based on the blood smear examination. Next slide, please. So these are the 5 important points you have to know before testing for canine babesiosis. And that is the main features of the canine babesiosis, and also you know about the organism. Know about the organism as well as the tick vector. Then accuracy, how to identify the diagnose the disease based on blood smear evaluation. But serologically we cannot diagnose, because serologically in chronic infection the antibody levels will be there. Then PCR assay, but PCR assay is a very important diagnostic test. Next slide, please. So nowadays, blood smear examination, then immunodiagnosis and molecular test, there is a omic era. That is the parasite biology. As I already told you, what all the cytokines are elevated in the infected dogs. So we have to collect the serum from the infected dog. Then we have to go for a proteomics analysis. So that is the work was done by one of my student, PhD student. Chandrasekhar is the member for that student. So we analyze many proteomics proteins elevated in that infected dog, specifically infected dog. Then again we are subjected for further analysis. What are the reason for the elevation? Then how we can overcome that elevation of these proteins. Next slide. This is a microscopic examination. It is clearly seen Babesia organism and all the red blood cells. Next slide. So here you can see the Babesia gibson in the right side top. You see in the left side, the vogeli, clearly you can see pear-shaped form. Whereas in the right side, you cannot see the pear-shaped form. That is a small dot or small dot like here, dot like, then some small structure will be there. So that it is difficult for identification. Only for experienced person can identify the Babesia gibsoni. Next slide, please. Next slide. Next. So this is the treatment. Treatment part I am not touching. Chandrasekhar will explain more about that. But based on there is one scientist, Gad Bennett, he is working mainly on the various treatment regimen for the canine babesiosis using various drugs, imidacloprid or even atrovacone, then clindamycin, metronidazole, doxycycline. So various combination of drugs. So in that topic, Dr. Chandrasekhar will speak at the end. Then I will skip it. Next. Next slide. Next slide. There are vaccines available for canine babesiosis. That is, one is Novivac Pyro. Previously, it was developed in Europe, but it was successful that time. But it will lower the severity, but it will not completely eliminate the infection. That is the drawback. So that nowadays it is not in the market. But nowadays, Pyro Dog, it is available, produced by Boehringer Ingelheim. It is used in other countries. Pyro Dog. It is a vaccine, exoantigen vaccine. It is mainly useful for bovine canine babesiosis. Next slide, please. Next. In babesiosis, some zoonotic aspect is also there. It is a growing public health crisis in several countries. Animal reservoirs play a vital role in the epidemiology of the disease, human babesiosis. Mainly the important zoonotic Babesia species, Babesia microti. So that is the one. It causes zoonotic. So the Babesia microti, sometimes it will cross the brain capillary. In brain capillary, it will form a clogging of brain capillary, so that it will cause severe complications, CNS disturbances. So this area we have to, is a recent area we have to study further on zoonotic aspect of the babesiosis. Next slide, please. So this the global map shows where the zoonotic babesiosis are prevalent. More than 20% are seen in mainly the Russia and that area. Then even USA also it is there. Next. So the this is about babesiosis. The next one is hepatozoonosis, but there is not a very severe disease, but still it causes some complications. And there are two species. One is Hepatozoonosis canis, another one is Hepatozoonosis americanum. It is mainly in America. Only in our country, Hepatozoonosis canis, the vector is the same, Rhipicephalus sanguinis, but here the transmission is through the ingestion of the tick by the dog. Normally in canine babesiosis, the dog will get the infection through the tick bite, whereas here the infected, the dog will get the infection by the ingestion of the tick. So that if the tick contains the organism, then the infection will develop in the dog. That is the important difference. Next slide. So this is the what I told you. So the tick injection by the dog. When the tick bites on the around the mouth area, or sometimes even the ground also, it will ingest the. Then another one is predation method. Next slide. So the main vector is the Rhipicephalus sanguinis. The same way, the infected after the injection of the tick, then it will enter into the definitely host dog. Then it will undergo asexual generation. Then asexual generation, then it will form a sexual generation, and then the sporozoites will be developed. So the same typical life cycle. Next slide. So here, while developing in the host, it will form a zyzon or neuron, form a cyst, onion skin cyst in that muscles, so that the muscular dystrophy, muscular pain will occur in case of hepatozoonosis, or even hind leg paralysis also encountered in the some of the affected dog. Next slide. So this is the typical entire life cycle, but I think this you have to, what you remember is only the infection occurs through the ingestion of the infected tick, then the sporozoid penetrate the tick gut, then undergo sporogony, merogony, then merozoites are released, then it will enter into the leukocytes, then tick will take the organism. Then the gametogony as well as sporogony occurs in the tick. Next slide. So this is the prevalence of canine hepatozoonosis. It is mostly in India. It is reported. In India, it is common. Then USA, Brazil, and all other countries, it is there. endemic country. Next slide. So the major clinical signs in case of Hepatozoonosis canis, though it is not life-threatening, sometimes it will cause severe hind leg paralysis and intermittent fever, anemia. So that is a very common clinical signs. Then, whereas in case of Hepatozoonosis americanum, that is a very severe one. But in India, Hepatozoonosis canis, it causes not much severe disease. Whereas Hepatozoonosis americanum in America, it causes a very severe disease where the vector is a amplioma, is a vector. Next slide. So this is the clinical presentation, mainly the affected animal depression. Muscular atrophy will be there. Sometimes diarrhea will blood in nature, but fluctuating fever. Then mucopurulent discharge. Then the organism, the blood smear, you can see very clearly the gelatin capsule shaped organism. The arrow mark shows clearly that is the gamma stage of the organism. That we can easily detect in the blood smear, but you have to look for the neutrophils. Normally for Babesiosis, we have to always see the erythrocytes. But for Hepatozoonosis canis, we have to always look for neutrophil, and the blood picture, neutrophilia will be there. Neutrophilia will be more. Next slide. So these are the common symptoms encountered in the Hepatozoonosis affected dog. Next. So the diagnosis, peripheral blood smear examination alone we can detect easily because in the infected dog neutrophilia will be there. So that naturally in the neutrophils we can see here you see the plenty of gamma stage of the Hepatozoonosis canis. In each neutrophil you can see clearly the gelatin capsule shaped gamma. That is very characteristic of the Hepatozoonosis canis. Apart from that, muscle biopsy you can see the Sison stage. Then IFFT test also you can do. Then polymerase chain reaction, that is a routine gold standard test you can detect. But for Hepatozoonosis canis, blood smear examination is sufficient. There is not much difficulty. Next slide. This is the in the muscle biopsy. So this is the Sison stage. You can see the Sison stage in the muscle structure. Next. So treatment option for Hepatozoonosis canis. So there is again sulfadiazine, trimethoprim, even clindamycin. The combination of drug also we can give. So that part will be detailed by Dr. Chandrasekhar. Next, please. Next. Okay. Next we will come on to the very important one, canine Ehrlichiosis. So like it is like a dengue fever in human being. In dengue fever, what will happen? There is a thrombocytopenia, severe thrombocytopenia will occur the same way in canine Ehrlichiosis. It is a severe thrombocytopenia occur. It is a pancytopenia, canine pancytopenia. So there are two species. One is Ehrlichia canis. Then another one is Ehrlichia evingi. Next one is Ehrlichia chafensis, that is mainly in a human being. Next, please. So we will see the Ehrlichia species of clinical importance. In India, only the Ehrlichia canis, important cause of human disease, no. Whereas in Ehrlichia evingi, it causes human, it will infect human being. Similarly, Ehrlichia chafensis, it will infect a human being. So important cause of canine disease, only Ehrlichia canis, in Ehrlichia evingi, but chafensis mainly affect human being. But the cell specificity, cell tropism, Ehrlichia canis only in monocytes. Whereas Ehrlichia evingae, it is a phagocytic cells, mainly neutrophil. That is the main difference based on cell tropism. Ehrlichia saphensis is also monocyte. Then tick vector Rhipicephalus sanguinis. For Ehrlichia evingae, Amblyomma americanum. For Ehrlichia saphensis also Amblyomma americanum. Then endemic region, it is Ehrlichia canis, all temperate climate or even worldwide, it is endemic. But Ehrlichia evingae and saphensis mainly in United States and Central America. Then nature of illness, it will form acute or chronic in case of Ehrlichia canis, whereas Ehrlichia evingae, acute illness mainly recognized. In saphensis also, acute illness in human being. But only in Ehrlichia canis, there is a chronic form of disease occur. Common clinical signs, if you see in the infected dog, in Ehrlichia canis, all you know, bleeding diathesis. Okay, there is a red patches in the lower part of the abdomen, then pancytopenia, then renal infection will be there, the neurological signs will occur like that. But in case of Ehrlichia evingae, possibly there is a renal infection, otherwise no. Then in saphensis, it is not clearly recognized. Next. So this is the prevalence of canine Ehrlichiosis, mainly where the in South America, then in USA, even in India, then even China, even globally it is very common disease, but the vector may vary. Next slide, please. So this shows the prevalence of canine Ehrlichiosis based on tick vector population. So only in India, the vector population, Rhipicephalus sanguinis is high, even in Afghanistan, Pakistan. But in other countries, mainly the Haemaphysalis longicornis act as a vector mainly. Next slide. So the main aspect of clinical signs of canine Ehrlichiosis, mainly the nasal or ocular discharge, then unusual bleeding is it is a bleeding disorder. Then swollen lymph nodes, then high fever, then lethargy, then sometimes vomition and diarrhea, or even without any clinical signs also we can get the case in clinics, in hospital. So, but we have to rule out the various possibilities. We have to rule out the disease. Even in our Madras Veterinary College also, we are doing regularly the screening of canine Ehrlichiosis based on even blood smear, but mainly we are doing a PCR based diagnosis for accuracy of the result. Next slide, please. So these are the three phases of the disease: acute, subclinical, subacute, chronic disease. So hemorrhages may be noticed, even corneal edema, that is one of the sign, then conjunctivitis, then muscle pain and stiffness, that is also one of the sign. Sometimes polyarthritis and seizures may occur. You can get even CNS disorder also there in case of canine Ehrlichiosis. Then epistaxis, that is one of the clear cut epistaxis and abdominal red spots. Then lymphadenomegaly, lymph node enlargement, then fever, then sometimes vestibular nature of the disease also will occur. Next slide. So this is a picture, Ehrlichia canis affected dog. There is a pale conjunctiva, then a bleached gingival mucosa. So that is a characteristic feature. Then icteric gingival mucosa clearly shown. Then bilateral nasal bleeding, that is one of the character. Then icteric abdomen. Then bilateral petechial hemorrhages you can see through the abdomen. Next slide, please. These are the mucosal petechial hemorrhages, where you see how much severely the dog is affected with the mucosal petechial hemorrhages. Similarly, ventral abdomen, skin petechiation due to thrombocytopenia occurs. This is clearly evident. Next. So coming on to the diagnosis part, microscopy is the one method. Then apart from that, we can do a IFIT test to detect the Ehrlichia canis. IFIT, indirect fluorescent antibody technique. So in that we can use only the fluorescent dye. We can ready-made slides are available as antigen slides. Then we have to put the antigen slide. Then we have to add that FITC labeled antibody. Then we have to see it under the fluorescent microscope. For that is the only drawback in that. But we can clearly visualize the green fluorescence of the morula stage. Actually, the organism will appear as a morula stage. Suppose if you see the blood smear, the monocytes, the organism will appear initially as a elementary bodies. Very small dot will be there in the cytoplasm of the monocyte. Normally, monocyte is a kidney-shaped nucleus. So, in the cytoplasm of the nuclei, the small dot will be there. Then later on, the small dot will aggregate slowly. That is the elementary bodies. Then the elementary bodies again aggregate further. Then it will become a morula stage. So the morula stage is mulberry-like structure. You can clearly evident in that monocyte, the cytoplasm of the monocyte. In the blood smear, you can detect. Another important thing, in case of canine Ehrlichiosis, if you see the blood smear, the monocytosis will be there. Monocyte population will be higher. So that naturally, you will get the morula stage of the organism. Then a polymerase chain reaction. That is also one of the a very recent test we are doing. Next slide. Here you can see clearly the Ehrlichia canis morulae within the cytoplasm of the monocyte. You see how much clearly you can see the mulberry-like structure, very prominent. The person seeing the microscope, here you can see the elementary bodies in the arrow mark. You show that is the elementary bodies, 1, 2 or 3 places the elementary bodies. That elementary bodies will aggregate, then it will form a morula stage like that. So this picture clearly shows the organism. Next. So this blood smear also you can see in the monocyte in the arrow mark. You can see the developing morula stage clearly. Next. So the treatment plan, mainly the choice include doxycycline, minocycline. There are many drugs are available. That a combination of drugs. Next. The next one is anaplasma. Recent days, even we are screening the dog for apart from canine babesiosis, then Ehrlichiosis, we are screening for anaplasma also. There is anaplasma platis nowadays gaining importance. So in anaplasma, there are 2 species. One is anaplasma phagocytophilium. That is infect neutrophils mainly. It causes human granulocytic anaplasmosis. Whereas another one, anaplasma platis, a vector is the Rhipicephalus sanguinis, but it will mainly affect the platelet. It is a platelet specific pathogen. It will affect it is present in the platelet that infect the dogs and causes canine infectious cyclic thrombocytopenia. So the condition is called canine infectious cyclic thrombocytopenia. Next. So if you see the difference between anaplasma phagocytophilium and the platis, based on tick vector, brown dog tick, that is the Rhipicephalus sanguinis. This is deer tick, that is mainly the Hemophysalis longicornis. Then common symptoms, both are the symptoms are more or less same only, but mainly in case of dog, severe joint pain will be there, then lameness, a fever, then inappetence, lethargy. Then uncommon clinical signs, bleeding, nose bleeding may occur in case of anaplasma platis. Then organism that is in phagocytophilium, white blood cells mainly neutrophils infected, but in anaplasma platis it is mainly platelets. Next slide. So this is a geographical distribution of the more than 6% endemic area, shows clearly. Next. So normally whether the anaplasma is a very danger for human being, the zoonotic aspect, it is not studied further clearly, but we have to rule out for the zoonotic aspect of the anaplasma platis, even in the dog handler also. Okay, next. Coming on to the clinical signs, mainly the fever, then usual clinical signs only. There is no clear cut, even sometimes bleeding disorders will be there, then lameness, then weight loss. So these are the asymptomatic only. Next. Because of this non-specific clinical manifestation and occurrence of co-infections, so the diagnosis is somewhat challenging. Current options for diagnosing anaplasmosis include visualization of morulae on the blood smear, mainly in the platelets. So in the platelet, we have to see the morula-like stage of the organism. But in case of severe infection, we can demonstrate. But in case of very mild infection, very difficult to detect in the blood smear. So that is a next. So this is the common this thing for the diagnosis of canine vector-borne diseases. First limitations in case of blood smear examination, it is unreliable method for diagnosis of mainly anaplasma platis due to the organism infecting the platelets. So we have to confirm whether it is an organism or not. So that is the one limitation. Then testing indicator is the thrombocytopenia. Then another one is accuracy. The anaplasma platis and anaplasma phagocytophyllum, we can identify the species difference is very difficult. So that based on PCR assay only we can differentiate the species. So nowadays the PCR run detection kit is a sensitive tool available for the diagnosis of the anaplasma platis infection. Next slide, please. So here you can see the anaplasma platis inclusions in the platelet. The arrow mark shows the platelet. In that you can see the morula-like stages. So these are the platelet. You can see the organism. Next slide. So here also in the platelet, you can see the organism clearly. The arrow mark shows clearly the organism, the lower one. Next. The treatment plan. Doxycycline is a drug we are using it. That part the Dr. Chandrasekhar will deal very soon. Next. So this is a screening test for vector-borne disease. IDEX company. There is a commercially available like lateral flow assay test for detecting even multi vector-borne disease pathogen. Next. So this part is not very common, canine trypanosomosis. This I will leave it. And also detection is very easy. In the blood smear, you can see the leaf-like structure of the organism. You can clearly demonstrate the canine trypanosomosis. But only two important clinical signs, clear-cut clinical signs are there in dog. One is corneal opacity. Then another one is laryngeal edema. Because of that laryngeal edema, there is a howling sound. The animal is in rabies condition. So that is the thing we have to rule out from the canine trypanosomosis. Otherwise, it is not very very prevalent in, but we are not rule out any stray dog population whether it is free from canine trypanosomosis or trypanosoma avansi. Next. Next. So this is the area where the trypanosomes are prevalent. Next slide. This is the T. avansi prevalent alone, mainly in India and China, Pakistan, even the African countries, it is common. Next. The diagnosis part. For trypanosoma diagnosis, there is no need of specific PCR-based diagnosis because the organism we can easily detect based on because this is a large size organism measuring 120 micron, whereas Babesiosis organism is only measuring 5 micron. This is a very large size. The blood smear in between the RBC, you can clearly see the organism. So that there is no need of, even though PCR we are doing, but by blood smear examination itself, we can easily detect the organism. Next. So mainly the clinical signs, anemia, fever, then corneal opacity, then laryngeal edema. Already I told you. Next. So this is a dog affected with corneal opacity. Next. So these are all the latest tests. That is a CRISPR case based point of care diagnosis for trypanosomosis, not only trypanosomosis, or even for all canine vector-borne diseases. It is available. It is the latest one, DNA based assay. Next. So this is a direct examination by blood smear. Organism you can see clearly. Then animal inoculation. That is the one method. The suspected animal, you take a blood, drop of blood, then inject into the mice. The mice, the organism will develop. Then you take a blood smear from the mice, then examine under the microscope the blood smear. You can see the organism. So the another one test is IFAT test. Here the organism fluoresces very clearly. IFAT. Next. Treatment part, there is a quinopyramine sulfate and even dynamicin acetate are routinely used drug in the treatment plan. Next. Control is mainly based on the treatment as well as this is also a vector-borne disease, but vector is the Tabanus vector, so that Tabanus control program is very difficult. We have to concentrate on the breeding area for Tabanus control. Then also we have to treat the affected animal. Next. So these are the routine managemental practices for spraying insecticidal in that in and around. Next. So this is the overview of pathogenesis of canine vector-borne disease, canine vector-borne infection. So some of the organism will affect mononuclear cells phagocytosis, so that the liver, spleen, lymph node, then thereby the splenomegaly will occur, then the reduction in the hemoglobin content. Then some will go for a lymphocytic perivascular cuffing will occur. Then thrombocytopenia, then hemorrhagic tendencies. So like that is a sequelae of the infection for canine vector-borne disease. Then finally the pancytopenia will occur. Next. So these are the overview of the canine vector-borne disease, blood smear examination. Then hematocrit method is there. Microhematocrit certification, concentrating the organism. Then PCR-based diagnosis. Then IFAT test. Next. So this is commercially available tick control products. That is next. Quick, please. So these are the for tick not tick control product, for a tick tweezer to remove the tick manually. Because if you are not removing the tick manually properly, then the mouth parts will be there. so that it will again damage. So that these tissues are used to remove the tick from the body of the animal. Next. How to remove the tick from the animal body? This is the one. It is available. Next. So these are all the all the product, repellent product, shampoo, spot on, anti-tick spray, tick collar, chewable. That's next. Various products are there. Okay. Next. Next. Tick collar. Then Serasto, small animal, large animal, then fipronil, all spot on, everything. Next. 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 This is the Sarolanar chewable tablet nowadays available. This is the older one, Amitras application. Next. Next. The Bravecto chews. Next. This is based on the animal size, the size of the tablet. Next. Next. So, okay. So this diagram shows where the ticks are available in the animal body. Okay, next. There is a blast, bath, look, apply, spray, and treat. So for tick control, there is a word blast for tick-borne disease. So you have to bathing properly, then look for the ticks, remove properly, then apply any repellent, then spray any commercial available, then treat accordingly using a veterinarian. Okay, next. Okay, next. These are the product. Next. Okay. So at the end, what I want to emphasize is for the canine vector-borne diseases, particularly for canine babesiosis, then canine Ehrlichiosis, then even Anaplasmosis. So here the diagnosis part is very, very important. So because the animal will not exhibit any clear-cut clinical signs, so we have to rule out the various infection. Then we have to pinpoint the infection, particularly for canine Hemoprotozoan infection. We have to go for molecular-based diagnosis, PCR-based assay to pinpoint the infection. Accordingly, we have to treat the infection very early so that we can save the animal. Then another important point in the control, normally we have to concentrate more on the where the dogs are there in the kennel or even the household where the dogs are living. The living area we have to concentrate more so that we can prevent the reinfection of the canine vector-borne disease. So this is about all an overview about canine vector-borne disease. Actually, the topic is very broad, so that I touched upon various aspects in a time. So I thank all the participants for your passion hearing. Thank you so much.
Thank you, Dr. Arun, for your wonderful and exhaustive informations. And the viewers, the most of them are self-explanatory. And if you can, go through the slides, you will be in a position to retrieve a lot of information. And some of the point, which I highlighted about the treatment aspect. And before getting to the, treatment aspect, and I want to thank, I want to thank TANUAS, the World Health Organization, ICR, NAHEP, and Department of Microbiology, Dr. John Kribaharan and Dr. Samuel of Madras Veterinary College, because they helped us in visiting Oklahoma State University, where, as Dr. Arun Kumar mentioned, there is a scientist name called Dr. Evingi. Actually, now we are speaking about Ehrlichia Evingi. The scientist, his working room only 100 square feet. Now they kept in a bigger room because after his death, the particular working area, they kept his name, Evingi Lab. So the lot of manuscript, whatever he has written, we thought of asking, we asked them, but they refused to give because for them it is very, very important to remember Evingi contribution. The message is, wherever you are, the contribution to the science is there, means the world will recognize. And also, I would like to thank Simon R., a scientist from Israel. And this is about, in the year 98, 99, when I worked on Ehrlichia canis, that time, 1998, 99 and all, this internet era is not so active. So that time I approached Simon R.S. We sent his entire booklet on canine Ehrlichiosis. So some of the treatment aspect I would like to highlight it. And the most important thing is, in our country, babies, now when I was a student, the more occurrence of Ehrlichia canis we observed, but now the Babesiosis zibzoni in higher percentage. Ehrlichia canis, the first line of treatment is doxycycline 10 milligram per kg body weight. Once a day, you need to give for 28 days. Apart from that, I also give prednisolone 2 milligram per kg body weight. Once a day for 3 days, 1 mg per kg body weight, once a day for 3 days, 0.5 milligram per kg body weight for 3 days. Higher dose too, I taper the prednisolone. The idea of using a prednisolone, majority of the E. canis organism that cause vasculitis. Because of vasculitis, only you are able to get the bleeding disorder. The bleeding disorder, you are able to see from the nostril, we call it as epistaxis. And, it is there all over the body. Even there is a condition called hypema, collection of blood in the anterior chamber of the eye. You can see by naked examination, you can able to see. They also call it as deadly killer disease. This problem, even abdominal blood vessel rupture, thoracic blood vessel rupture, that's the reason there are scientists, they call it a silent and deadly killer disease. The E. canis, they also call it cytokine. It reduces the WBC, it reduces the RBC, it reduces the platelet, and they call it as pancytopenia. It will also cause the bone marrow suppression. So once you starting with the doxycycline 10 mg per kg body weight once a day, and you can see the clinical improvement, high temperature reduced, and all the clinical sign will subside, like epistaxis will reduce, and the platelet count will improve. And these are all the observation you can see. Majority of the E. canis, and it's a multi-system affecting blood rickettsial disease. It's starting with the brain, starting with the nose, starting with the eye, and lung, pericardium, gastrointestinal tract, liver, kidney, spleen, nervous system, all the organ, it can attack. So once he attacks, you will have a diphasic fever, and then diphasic fever, increased temperature, decreased temperature, enlarged lymph node, collection of blood in the anterior chamber of the eye, purulent nasal discharge, hematomesis, hematogasia, and there are occasional central nervous system involvement. You will get convulsion also. Ecchymotic patches because of the low platelet count and the vasculitis, and the red patches varying from small size to bigger size. And as he mentioned, it is also going for multi-organ failure. The delay in the treatment and the aggregation of the platelet, it will occlude the renal artery, hepatic artery, multi-organ failure. It can end up, it's due to disseminated intravascular coagulation. It will also going for immune-mediated, thrombocytopenia. So in that occasion, administration of steroid also absolutely essential. So that is the way. And apart from that, regarding the management of blood transfusion, that itself another topic. Subsequent days we'll broadcast the anemic dog. You can, as of now, you can go for collecting the blood from the donor. You do a cross matching. You check whether the dog erythrocyte 1.1 negative is available. If it is 1.1 negative available, you can go for collecting the blood from the donor. The donor should be 1.1 negative. In that case, you can collect the blood. Again, you do the major matching, minor matching. If it is fit, you can go for blood transfusion. Initially, you have to go for slowly. Then after that, you can increase the speed. That is the way the anemia you can counteract by giving the blood transfusion. And then, so majority of the EKNs end up with renal failure, hepatic failure. Once they get the renal failure, elevation of blood urine antigen creatinine will be there. Nowadays, you can also look into SDMA elevations. When the SDMA elevation more than 18 microgram per deciliter, you can think about renal involvement. In that occasion, apart from using doxycycline, giving fluid therapy also available must. And you need to go for phosphate binder. You check whether it is animal is having hypertension. That also you need to tackle. It's a multiple way you need to tackle the EKNS problem. And there are herbal preparations. They are claiming that it is helping. They are giving a thrombus syrup. You can give morning 10 ml, evening 10 ml. It's a bigger dog. Smaller dog mean evening 5 ml, morning 5 ml you can give. This is the way doxycycline globally they are managing. Till this minute, doxycycline 10 milligram per kg body weight is the recommended dose for 28 days all over the world. And then regarding the tick control, as Dr. Arun mentioned, Rhephysaccalus sanguinus is the important tick it causing the problem. So controlling the tick is very important. The control measures starting with the powder. Topically, you can apply the powder. There are collar available coated with amidras. You can tie the collar. And there are a topical application of, insecticide, starting with, you can also use organophosphorus compound like, deltamethrin available. Topically, your topically. The side effect of the deltamethrin, if accidentally animal lick, it will become poisonous. So you need to apply very careful manner. Controlling the ticks in the surrounding, it's very, very important. There are insecticide. The deltamethrin compound, 4 ml, 1 liter water, you can dilute by using the insecticidal spray gun. You need to spray. And, there are cypermethrin also you can use. The most important thing is, most important way of controlling the egg, nymphal, adult, larval stage, better you go for, using the flame gun. All the poultry said they are using the flame gun. Similarly, you need to use a flame gun to control the, various stages of the ticks. That is the effective, cheaper method. That is not available. Any of the viewer, they can also market it, prepare a flame gun, how that is used for poultry. You can design, you can also patent it, you can, circulate to the world pet parents. So that is another idea I am giving. So there are, the controls. It's the duty of the pet parents who need to look at the dog from nose to tail. The dog which are having a lot of fur, the tick arboring is a common problem. They hide into the ear canal, they hide into the digits, they hide around the handle and the abdominal region, inguinal region, it will hide. These are the hide when they are having a lot of fur. This is the area, they want to hide. And, they can, when they detach from the dog, they can live without blood for several months. When the opportunity comes, they suck the blood and then survive. Even the one tick, it can cause, multiple level of organism transmission. And the most important thing is, once Dr. Arun mentioned clearly, you have to use some forceps to remove the ticks. Manually, if you remove the ticks, the tick blood, the every possibility, he has mentioned lot of zoonotic occurrences. The every possibility zoonotic transmission will be there. So to avoid that, always use forceps and also wear a gloves. Because nowadays there are inquiries from other countries. They want to do a collaboration with us because there are, this Hemoprotozoan disease, zoonotic occurrences they are able to observe. It is starting with the Babesiosis, Ehrlichiosis, and starting with, even trypanosomes. There are multiple Hemoprotozoan disease that they want to collaborate. And we are also working. There are similar occurrences. As he mentions, it will going for multiple organ. There are child going for multiple organ failure. There are many intensive care specialists. They are working with me. They are trying with the various modality of the treatment. They couldn't, save the child because they are strongly believing that there are zoonotic occurrences from the animal origin, mainly Hemoprotozoan disease. They thinking that causing this type of multiple organ dysfunction in child and also in some of the adult. They are trying various modality of the treatment. In spite of they couldn't save some of the child and the adult. So that work also we are keeping in our mind. We are going to take it up in future. And then coming to this, control the ticks. You have Spartan. There are various companies. They have Spartan. Recently you have a product called Bravecto. Yes, mentioned based on the body weight using the Bravecto. Symbaric also available based on the body weight you can use. There are powders. Companies, various companies. One of the chemical name is Propexar. Dusting powder you can use. There are collar you can tie it around the neck, and there are combination of this will also will help. You are giving Bravecto or any tablet to control the ticks. Apart from that, tying the collar also it will be of meaningful. So because the collar can protect, give the protection for 6 months. Sometimes it fades where you need to remove the external the chemical, then tie it around the neck. While bathing the dog, remove the collar and then tie it again. That will help. And there are few places they also try ivermectin 200 microgram per kg body weight once a week. For 3-4 weeks they also try. But especially cat, don't try amidress external. It will die. You should not use amidress because it's toxic to the cat. And then on many occasions, wherever you are having the kennel, the Rhipicephalus sanguinus, it will be in the kennel for longer time. So kennel tick control measure is very, very important. One of the cheapest method which I mentioned, about the using, it is called about using the flame gun. And you can also use the insecticide to control the ticks in the premises. It's very, very important. And many places, the corporation people, they have a big tank. In that tank, you mix the delta methylene compound or cypermethylene compound based on the recommendation. You mix and then spray in the room so that you can control the ticks. And the most important thing which I want to insist on, I want to insist all the practitioners. India, nobody is having the counseling room. When I was visiting abroad, they have a counseling, most of the universities, Michigan State, Oklahoma State University, they have counseling room. They call the pet parents and then explain the existing problem of the pets. And, they interact, they make the owner to understand what the problem pet is having. That is very important to avoid all the legal point of view, to avoid the, pet like a family member, to avoid the, mental upset. So better give the counseling. If you give the counseling, all these problem can be minimized. And coming to the Babesia zibzoni, see, as per the, there are various protocol. Atavac and azithromycin, one combination, one group of scientists they are recommending. Another group of scientists they are recommending doxycycline, metronidazole, clindamycin, or various dose they are recommending. Some group of scientists they are taking clindamycin alone. There are various protocols that are available. So what I am following in my practice, first of all, Babesia zibzoni, over the scientists, whether Simon Harris or scientists from Taiwan or scientists from various other country also. Once the animal get Babesia zibzoni, you can you can treat the problem. It depends upon the severity. The response varies. Majority of the time, once they get it, it will be there for longer time. So when the immunity is suppressed, the blood parasite flare up. So that you have to explain to the owner. Maximum pet parent they coming with the vets, thinking that once they start the treatment, it will completely eradicate. See, I have seen E. canis cases when we treated the E. canis with the doxycycline. And in earlier days, we use oxytetracycline 10 mg per kg body twice a day. We treat for a couple of 3 weeks. And in those occasions also, we found a better response rate. The animal lived 10, 12, 15 years. But here, the Babesiosis zibzoni, though the combination of this starting with atavactin, azithromycin, doxycycline, clindamycin, metronidazole combination, or clindamycin separate group, these are all the recommendation. In spite of that, there are varying response I could see. I will not tell the owner that I completely cure Babesiosis zibzoni. I will call the owner. I will tell them if pet is having a Babesiosis zibzoni, it is an alarming problem. It will cause multiple organ failure. It can cause renal failure. It can cause liver failure and disseminator intravascular coagulation. And then the death of the animal can be encountered. But if the yearly referral, and the majority of them, since I am doing dialysis, they refer the case throughout India to me to do dialysis. Once you treat the primary problem, then only you can eradicate the problem. Doing a dialysis, I do dialysis, I can purify the blood urine nitrogen creatinine will come down. That time the animal will become comfortable. Once you don't remove the primary problem, again the blood urine nitrogen creatinine getting elevated. So the recommendation is, there are various protocols that are available. What I am following in my place, I am following a doxycycline 10 milligram per kg body once a day for 28 days I follow. Then metronidazole 10 milligram per kg body weight, BID twice a day for 28 days I follow. Clindamycin 15 milligram per kg body weight, BID for 28 days. There are other quoting clindamycin 25 milligram per kg body weight, BID for 28 days they follow. There are these drugs, when you are putting on with longer time also, there are side effects in that. Those things you have to explain to the owner. Then only, you can, the owner can understand your effort. And apart from that, supplemental, we can also give a thrombus, the papaya, fruits also we can give it to the pets whenever, the platelet level zone. And E. canis or Babesiosis zibzoni, Anaplasmosis, and all these Hemoprotozoan disease, the reduction of platelet thrombocytopenia is alarming problem. And also the platelet may be normal in the morning, afternoon may be decreased, evening may be animal in a critical condition. So always depend on the platelet normal 1,50,000. Above. Suppose the platelet count to 50,000, it is clearly indicating that the animal is carrying the Hemoprotozoan disease. Though your blood smear may be negative, and then there are false positive, false negative in PCR, but once you see a platelet count less than 50,000, top priority given to Hemoprotozoan disease. Don't wait for your confirmation. Put him on the doxycycline. That will save 50% of the cases. After that, you confirm whether it is Anaplasmosis or Ehrlichiosis or Babesiosis zibzoni, and or Hepatozoonosis canis. All these parasites, you have except Trypanosomosis, all these parasites, I am talking about Ehrlichiosis, Babesiosis zibzoni, Anaplasmosis, Hepatozoonosis, the doxycycline is the baseline of treatment. You put him on the doxycycline, and you can see the improvement. After that, identify the cause and accordingly you treat. That's what I want to insist. And Babesiosis canis, normally I use diaminosin acetate 3.5 milligram per kg body weight intramuscularly I administer. And the trypanosomosis, as he mentioned, corneal opacity and blindness encountered in dogs. And once you take a drop of blood, whole blood, put it on the slide, put a cover slip, look at it under the low power and also high power, you can see the streaming of trypanosome movement. Normally, I use Tricune in olden days, and we found better success rate. And we also use Berenil 3.5 milligram per kg body weight to tackle the the trypanosomosis. And one more point, though it is not there, maybe north, because throughout the India, the other country, we were also available. So we have observed in the past 30 years, we have observed a few recurrence of microfilaria also in our place. And, it's actually accidental. And animal not eating become dull, and they brought it for checkup. We found high temperature. We collected the blood sample. Anyway, we thought of checking the wet film, and we found the steaming of microfilaria movement. And then we put him on the ivermectin 200 microgram per kg body weight subcutaneously once a week for 3 weeks. That was eradicated completely. So in a nutshell, tick control in the environment is very important. And the use of flame gun, it's very, very important. The various preparations like Spartan, Spartan also where you have to apply. For a youngster, I am telling, there are senior practitioners are there, they know. The youngster, you must know where to apply. So normally, the medicine should contact on the skin. Many times if you are putting on the fur, it will evaporate and it will not have action. Actually, when you put on the skin, it will spread all over the body of the animal. It get deposited in the sebaceous gland, and then slowly it will release, and all the tick will go away. And if you are and another part, if you are applying Spartan, you should not bathe the dog for 2 weeks. That is another important concept I want to tell you. Kiltic collar, already I told you. These are all some of the informations, and we cannot finish within 1.5 hours the entire topic. It is time consuming. In each and every topic, we can take for 1 to 2 hours. That we'll do it later on. Since I want to update all the information, I would like to add on this. And some of the questionnaire I'll see, And so my well-wisher, Dr. Subir Bhattacharya, he asked, canine vector-borne disease, IMHA can sometimes be a secondary triggering factor, and also sometimes conventional antibiotic treatment fail to take effect. In such cases, does plasmapheresis fit into treatment modules? Please enlighten. Yes, plasmapheresis, immune-mediated hemolytic anemia, they are removing the patient plasma. We need to administer the newer plasma. And that will also can help. And I have the equipment. Nobody referred for plasmapheresis for this technique, Dr. Subir. And so in of your slide you mentioned about vincretin. Would you elaborate on this further? So especially in case of immune-mediated thrombocytopenia, the vincretin administration 0.025 milligram per kg body weight, you need to give intravenously. That will improve the platelet count. That's also available in some of the occasions. And normally, he's the only listener appreciate, all our presentations. Then so the Kirti was asked, babesiosis when acute kidney injury, which is the antibiotic therapy considering the renal issue? Can we use the diaminoxazolide or imidacloprid? See, in the PowerPoint slide, we will also share you the list of protocol. We start with azithromycin, atavaquin. This also we can try. But, the renal problem in Babesia zibzoni, the primary problem is Babesiosis injury. If you are addressing with the doxycycline, I know it's these drug metronidazole, it can cause renal issues. But if you can control with 1 or 2 application, the Babesia zibzoni organism level minimize, you can see the reduction of blood urine nitrogen and creatinine, and then after that you can you can continue the medications. And then babies, especially 2 to 3 month old puppy, in triple therapy doxycycline metronidazole fail. Can we use imidacorp or Berenils? So maybe atavaquin, azithromycin can be tried in case of puppies. What about feline hemoprotozoan disease? Feline hemoprotozoan is also hemophilus please. Doxycycline is the line of treatment, Jonek. And what I want to insist, feline viral infection, feline hemoprotozoan, we are having in the subsequent webinar. So these are all some of the questionnaires which they asked during the presentations. Yeah, so these are all some of the questions. And see, this is very important. See, anorexia, lethargy, pale mucous membrane weakness, abnormal rapid breathing, vomiting, jaundice, neurological, watery fluid causing swelling of the head and legs, and a sudden onset with shock. And you see, see, it is involving all other organ. So whenever you suspect a case of Babesia zibzoni, and when you confirm the case, you need to look into all these parameters. That's what I want to highlight. Next slide. These already explained. Go to the next. 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 Treatment. Next. So now you see, so really, Babesiosis, you see, Babesiosis, even they are recommending buparvacin, 20 milligram per kg subcutaneously once. That is also some of the other recommending. Now I told about atavacone azithromycin combination. Atavacone 13.3 milligram per kg per orally. Every 8 hours for 10 days you have to give. Another drug, azithromycin, we need to use 10 milligram per kg body weight. Every 24 hours for 10 days you have to give. So these are all the combination of drug. Even one place, clindamycin 25 milligram per kg, every 12 hours per orally also they recommended. Then combination I told you, clindamycin, metronidazole, doxycycline, clindamycin 25 milligram every 12 hours. Then metronidazole, metronidazole 5 mg per kg every 12 hours. Doxycycline 5 mg per kg. This is another combination. So another place they tried buparvacin plus azithromycin combination. Buparvacin 5 milligram per kg intramuscular 2 days. Then azithromycin they included 10 mg per kg body every 24 hours for 10 days. These are all the recommended drugs. Nobody can claim that completely they can cure. So this is the combination of the therapy. Each and every scientist, each and every practitioner, they have their own protocol in approaching and treating this case. And another important person, important in my 30 years of clinical experience, when I started the practice, I found more amount of Ehrlichiosis. Now I am seeing more amount of Babesiosis. And there are some scientific article. I could see more amount of thrombocytopenia and more amount of Babesiosis. Apart from that, I am thinking there is a viral infection also behind it. There is a Bunia virus playing an important role spreading the vast. Like, how the corona airborne infection occurring. Like that, I am thinking, the Bunia virus concurrently with the Babesiosis, it is spreading enormously. There are scientific reports, scientific published data available. Already we worked with the Bunia virus playing an important role spreading of this, along with the Babesiosis, it is causing the thrombocytopenia. But we couldn't identify in one of the study. But I am strongly feeling there is a virus behind this role, because entire India I could see thrombocytopenia, anemia, and this was not there in 20 years before. 20 years before we get Ehrlichiosis or Babesiosis, we treat with the recommended drug. Olden days we have only oxytetracycline, we don't have doxycycline. We use oxytetracycline, we maintained a couple of dogs healthy, we didn't face any problem. Babesiosis we are treating. In spite of treating, we get a lot of failure. With the doxycycline itself, the cost of the drug is 400 rupees. 400 rupees and including your consultation and treatment, nearly 1,500 single visit the owner is spending. If they are spending for a couple of weeks, then imagine the expenses. The net result also, it's a variable result. And these are all the information I would like to share you. And viewers, they can, go to, shortly we'll share this PowerPoint slide. You can make use of this PowerPoint slide for verification. There are some more protocol also available. You can make use of this. With this, I conclude. I want to thank Hatvet PHARMA for their digital partner contribution. And I could see the viewers, those who are interested, they want to contribute something to the pets. They are listening from the beginning till end. And Arun Kumar, today is the college annual day conference. A cultural program is going on. He is a good singer. He sing Hindi song to all national language song. I told him to be here because the expert should talk about this. So I'm a practitioner, I'm a clinician, but expertise should be there to share the knowledge. I thank all the viewers and Dr. Arun Kumar and Hatvet PHARMA for this nice arrangement. Thank you very much. With this, I conclude. We see you feline viral infection, diagnosis aspect, one biotechnology will speak. Treatment aspect, I will share you like this. With this, I conclude.